For some of our kids, this is the last weekend of summer vacation. Boise School District starts class on Monday. But for a lot of others, there's still a few days and even a couple weeks left. And during that time, we're bound to hear more discussions and arguments about whether those kids, in an effort to curb the rising spread of the coronavirus, should be required to wear face coverings in the classroom, in the hallways, indoors. The Boise School District has already decided to follow the CDC and Central District health guidelines and make masks mandatory indoors. For the other districts, it remains optional. We wanted to take a look at this issue from two different angles: the scientific side and the psychological side of going with the optional option. First, let's lay out the facts and the scenario for the scientific side. The Delta variant is the dominant strain in Idaho at this point, a version far more contagious than the original COVID-19. And we're seeing numbers now we haven't seen since the tail end of the last surge. It's more contagious, scientists say, because of what they call the viral load, or the density of the viral particles in your body. That's the amount of virus that they're finding in the nose and throat of those infected. And with Delta, it's much higher, like by a lot. A study has shown the viral particles of Delta to be 1,260 times higher than the OG strain of COVID. And Delta has been pretty prevalent with kids, unlike the previous versions. With 12 and under unable to get the vaccine right now, that potential with that spread has become quite the problem. So we wanted to ask Dr. David Pate about this. Dr. Pate is the former CEO of St. Luke's Health System. He has experience with crisis care standards from his time in Texas, and he's a member of the governor's coronavirus working group. So we brought him a potential schoolroom scenario that is likely this fall in a school where masks are not required. A classroom filled with 20 to 30 kids, some wearing masks, many not. What can happen with a kid who isn't wearing one?
If a child's in that room and has Delta, the first thing is they may or may not know they're sick. So they may be asymptomatic, but they will have this very high level of virus. What happens is the virus gets in the air. It gets in the air from talking, breathing, coughing, sneezing, yelling, singing, whatever they're doing. That's how it gets in the air.
Dr. Pate says there are two ways the virus spreads. One being respiratory droplets. That's the saliva and secretions coming out of your mouth when you do the talking, coughing, and singing things. And those particles are usually large enough to see if you put a glass screen in front of your face while doing them.
If that respiratory droplet then lands on your face and you're not wearing the mask, it could be introduced into your nose or throat.
Or they could land on your desk. Then you touch them, then touch your face. The other form of transmission is airborne.
Airborne, we're talking about now much smaller amounts.
Dr. Pate says while droplets will drop to the ground, and because of gravity, usually within 6 feet, aerosols are lighter.
Aerosols travel on airstreams throughout the room. And so this is how people that are sitting across the room could actually get infected. The CDC believes respiratory droplets are still the primary way people get infected. But I will tell you, I think there's very little certainty of this. And certainly when we hear the cases where large numbers of people are being infected and weren't necessarily enclosed, that's probably aerosol. So wearing a mask is going to cover the nose and mouth. So at least those big particles that I talked about on the glass or mirror, they're going to get held up in this and not travel to you as much.
And, Dr. Pate says, a study released last year showed masks also helped slow aerosol transmission.
Doesn't eliminate it, but it decreases it significantly. Now, on the flip side, you wearing the mask in the room if I'm infected. If I'm not wearing a mask and I am projecting both droplets and aerosols in the room, at least this mask will provide some degree of a barrier to you breathing in these virus droplets that I'm putting out there. Won't be perfect, but it will decrease it.
We've had this a couple of times and people point this out. How could a mask like this, a disposable mask or a cloth mask that people use, be effective against something like an aerosol?
Yeah, I was surprised as well. But the studies came out last year and showed the first thing is having the mask is actually decreases the amount of aerosols you put into the room. The second thing is if you wear it properly, it won't decrease it 100%, but it decreases it significantly. And frankly, if the virus is going to be in the air that you're in, then your next big hope is at least decrease the amount of virus that you get exposed to, because perhaps you might get exposed to virus, but it'll be less than what we call the infectious dose, the amount of virus that it would take to infect you. And even if not, if you do get infected, we still have reason to believe the less virus you get infected with, the less severe your illness will be. So those are the benefits. It's not 100%, but it is going to give you a huge help. It's just like a bulletproof vest isn't 100% effective either. But if somebody's shooting at me, I sure would like to have one.
Okay, so that's the scientific side of some kids wearing masks and some not. And you heard Dr. Pate mention studies that have shown these things. Studies seem kind of general, we know, but like Sean asked a couple of days ago, or rather requested, please bring to all of our attention that scientific research showing masks help stop spreading COVID-19. Well, we did ask Dr. Pate about this, but even he admitted there isn't a specific website where all of these studies are being collected right now. They're kind of all over the place. He suggested starting with the CDC website, the National Institute of Health website. You could even look at a website called CIDRAP. But again, start with the CDC and the NIH and then search masks. We've also included some links in this story at KTVB.com. Okay, so what about the psychological side? The peer pressure, the anxiety, the desire to not want to be different. For that, we reached out to Dr. Scott Hoops, a Meridian psychiatrist who works with kids. He told us elementary school kids usually adopt the values and points of views of their parents, and wearing or not wearing a mask in class will be more of an emotional thing, without a fully developed rational mind. With adolescents, that middle to high school age, it'll be some of the same thing. They tend to follow parents' values, but they can sometimes do their own thing. And unfortunately, as humans, we tend to divide quickly and easily into groups. Those who agree with us and those that don't. And those not like us, well, we tend to be a little bit less generous with them. Our kids have been the focus of these face-covering confrontations, but it's also put them smack in the middle of it.
But it seems to me the bottom line is it's going to create out-group, in-group. That's going to create conflict and tension. With elementary school kids especially, it's going to be very emotionally based. Adolescents, you're going to add some rationality to it. But let's be fair, we adults aren't being very rational about this either.
This conflict thing, in addition to all the other stuff that you have to deal with in middle school and whatever, that can't be good to add another whole layer of stuff.
Well, exactly. And so for the elementary school kids, it's defending my parents and my family, my people, right? And again, how can that not be emotional? And that division between kids is not going to be acted out in a happy way quite often.
How much of this conflict between, masks, no masks, vaccinated, not vaccinated, that their parents are dealing with are trickling down into the kids?
Well, very largely, that's the point. And it's just, it's bombarded in the media. How could you look at any media without being exposed to something like this? And then it's hard for parents not to be caught up with it with child-age children, because one of the most powerful impulses, inclinations we have as human beings is protecting our children. And then, of course, what are you protecting them against? Are you protecting them against the tyrants in government that want to dictate every action? Or are you protecting them against the reckless people who want you to get to a disease and drop dead? Well, those are fundamental kind of value things that we as adults are struggling with.
So none of this is really shaping up to be a solid, nurturing atmosphere for kids, I'm guessing.
No, not. And again, with kids, it's up to us as adults to lead them out, to show them a way. In all of human history so far, when there has been crises, people have found a way out, and often that way out has been constructive and positive. At this point, we're struggling with that, right? And there's a lot of forces that are polarizing us as a society that children have and adolescents that simply don't have the tools to deal with at all.
Well, I asked Dr. Hoops how he suggests that parents talk to their kids about situations like this when they go into the classroom and see that they're not wearing a mask, or the others are not wearing the mask, but they are, and all that kind of stuff. And he basically said it's kind of like that in-group and out-group. You have to find that common ground. You got to talk to each other, but you also have to be generous with each other. And there's no real easy answer to this other than trying not to put that pressure that you're feeling with this whole situation onto your kids.